Intervertebral disc herniation, often abbreviated as IVDH, is recognized as the most frequent disease affecting the spinal cord in our canine companions. While cervical or neck-related, IVDH accounts for roughly 15% of all IVDH cases in dogs. There has been a notable gap in our understanding regarding the specific clinical presentation of nerve root signature when it occurs alongside these cervical disc issues. Nerve root signature, or NRS, is a clinical syndrome that manifests as a dog holding up one of its front legs in a non-weight-bearing manner while standing. This peculiar posture is thought to be an indication of pain stemming from the entrapment or irritation of a spinal nerve or its root. While nerve root signature is most often observed in conjunction with intervertebral disc herniation and tumors involving nerve roots, it can also arise from various other underlying causes, including trauma, the formation of abnormal bony growths, inflammatory processes, degenerative conditions, and other types of growths. The precise mechanisms leading to nerve root signature remain unclear and are likely complex, potentially involving a combination of direct compression, inflammation, and a disruption of the blood supply to the sensitive nerve roots. In human medicine, a comparable condition known as cervical radiculopathy is well documented in individuals with cervical disc disease. These patients typically report pain that radiates along specific pathways related to the affected nerve root, often extending into the shoulder, arm, or fingers, particularly when disc material extrudes and impacts the 5th through 8th cervical nerve roots. A prior study focusing on human patients who underwent surgery for cervical radiculopathy found that almost all of them experienced arm pain, with the C6 and C7 nerve roots being the most commonly involved. Veterinarians generally agree that in dogs, cervical nerve root signature is most frequently associated with the involvement of nerve roots originating from the C6 to T2 spinal cord segments, which form part of the cervical enlargement and innervate the muscles of the front limb. However, the researchers in this study noted a lack of objective assessments of the clinical presentation in dogs with nerve root signature. This study has provided valuable insights into the clinical and imaging characteristics of nerve root signature associated with cervical intervertebral disc herniation in dogs. It has demonstrated that nerve root signature can occur in conjunction with intervertebral disc herniation at any disc site within the cervical spine, although it is significantly more prevalent with involvement of the more caudal cervical disc sites, particularly C6, C7. Additionally, the study has shown that nerve root signature is more frequently associated with lateral disc herniations and those that result in compression of the intervertebral foramen, but it can also be present even when these specific imaging findings are not clearly apparent.